Kita na po ba? Hello po.
Yes po, ma'am.
Yes po, ma'am.
Our topic today is regarding physiologic changes in aging and changes in mind. So, yung lahat ng appearance, yung mga physical aspect ng mga ating older adult, makikita kagad natin, di po ba? There's a factor kung sila ay bata pa or matanda. Okay, so our learning objectives this afternoon is to identify the common age-related changes at the cellular level in physical appearance and to the respiratory, cardiovascular, gastrointestinal, urinary system, reproductive, musculoskeletal, nervous system, endocrine system, integumentary, and sensory organs. So, in physiologic changes in aging affecting various changes, ano kaya ang makikita natin? Just like for integumentary. Okay? So, there are 5 age-related changes that occur in integumentary system. Okay? So, such as you can see to the older adult, meron silang wrinkles or nagkakaroon sila ng moles, age spot, most common po yan sa mga older adult, dryness, thinning, and pigment changes in the hair and also in the skin. Okay? So sabi natin, ma'am, it becomes thinner and more easily damaged. So intensifying this effect is the decreasing ability of the skin to heal itself with age. And the skin aging is also noted by decrease in volume and elasticity. Kaya nga po, di ba, nagre-wrinkle, makikita mo siya. And the increased incidence of the wrinkles. The aging receives less blood flow, that is one of the age-related changes, and lower the glandular activity. So these are the effects. There is a wrinkling, decrease of the skin immune responsiveness. Kaya nga 'di ba, yung sa mga skin sa mga matatanda, kapag ka po yan, for example, nagluluto, okay? Mainit yung kaldero, yung takip ng kaldero. Minsan nabubuksan nila, hindi nila nalalaman na na pala, nasusunog na yung balat nila. So, yung receptor ng kanilang mga balat medyo decrease na. That is why they are prone sa burn. Decrease also the sweat production. So, there is less productions. Yung ating mga subcutaneous fats, especially sa mga matatanda, medyo naglo-loss na. Kaya what happened? Kaya po yung mga matatanda, manonotice nyo, kasama pa rin diba sa skin, yung heat temperature, yung mga sweat production. Kaya most common sa mga matatanda, medyo ginawin po sila. Okay? So, decrease in skin thickness also increase the susceptibility to pathological condition. And the growth of the hair and the nails also decreases. You can notice also, medyo nagiging thick yung mga nails nila. Medyo yung growth nun, hindi na ganun kabilis. Pero kumakapal pag mahirap gupitan sa mga matatanda. And also, factor sa hair, medyo muminipis na. The nails become brittle with age. So, let's talk about the musculoskeletal. So, dito sa care of an older adult, I will not discuss anatomy, physiology, the age relate, yung mga kanilang system. Ang dinidiscuss lang natin, so kung ano yung mga pagbabago dun sa mga matatanda. So, musculoskeletal, what happened? Okay? With age, what happened to the bone? Tend to shrink. Lumiliit po yan. In size and density, there is also weakening them and making them more susceptible to fracture. So, decrease ang height, kasi look at spine, lalo na, di ba? Nagko-compress. Okay? So yung mga structures natin, yung mga bone natin sa likod, kaya nga po, you observe sa mga matatanda, siguro nung bata pa sila, matangkad sila. Pero pagka tumatanda, medyo nahuhukot sila, di ba? Nagkakaroon ng kyphosis. And there is also the compression, brittleness of the bone. Kaya pagka na-compress po yan, medyo lumiliit yung tignan. Increased postural sway. There is also difficulty in balance, shrinking vertebral disc, and slight kyphosis. So loss of the bone mass, and bones are more brittle. Kaya nga they are prone to fracture, di po ba? Muscle atrophy also, and decrease the lean body mass. The joint, there is joint degeneration, cartilage surface. So lahat naman yan, di ba? Degenerative. Okay? Due to sa pagtanda, kaya po nagkakaroon ng pagbabago. Okay? So what else? What are the common foot problems na makikita natin sa mga matatanda? Kung sino man may mga kasama sa inyo sa bahay, you notice. Okay? Tingnan niyo yung foot. So medyo parang nagkakaroon siya ng bukol or yung buto dito. Okay, bone ions. So dito makikita mo rin yon. Kaya nga po yung factor, ano, yung tsinelas ng mga matatanda, lalo na kung may stripe na, okay, may stripe po yan, medyo nahihirapan sila. Dapat nakaipit lang kasi because of this factor. Ito po yon. Okay? So what else? There is also a corn. Ito po yung tawag sa corn. Parang kung aakalahin mo, kasi ito, this one is callus. So nagkakaroon din po ng ganyan. Most common sa matatanda. And this is the corn. Ito po medyo para siyang corn na structure, pero matigas po yan. At saka medyo masakit din po yan. Okay. Wait lang po. Okay, that is in the bone. Okay. How about respiratory? What are the common, okay, respiratory problem? Sorry po, biglang nawala. Okay, in respiratory, okay, there are several changes that happen to the older adult. There is decline in lung capacity. So what happened if there's decline in lung capacity? There will be an alveoli can lose its shape and become baggy. So alam naman natin, di ba, the alveoli that is responsible for exchange of gases. What else? The diaphragm, okay, can over time become weaker. Kaya nga po, maobserbahan natin yung paghinga ng mga matatanda, no? Kasi because of the changes. Eh di ba, pag nag-inhale, exhale tayo, we use our diaphragm and yung mga respiratory muscles. Decreasing the ability to inhale and exhale. Okay? So, what else? What are the common changes? There is also decrease and peak airflow. This is how quickly someone can exhale and exchange of the carbon dioxide and oxygen. Decrease in measures of the lung function, weakening in the respiratory muscles. So after about the age of 35, it is normal for our lung function to decline gradually as we age. Nababago po yan at the age of 35. This can make breathing slightly more difficult as you get older. And if you notice any sudden difficulties in breathing or shortness of breath, talk to your doctor right away. So kapag na-observe ninyo, there's difficulty of breathing, so kailangan you have to consult the doctor. So what else? Some other changes in respiratory. There is also decrease the chest wall compliance, decrease the maximal breathing capacity, decrease the number of the alveoli, elasticity, and decrease the lung parenchyma, impaired also the cup reflex, and this increase. Kaya nga, di ba, they are prone of having vulnerability to hypoxia and emphysema. So, what are the changes? Ano yung lifestyle nila? So, kung ang lifestyle nila hindi rin maganda due to related changes, lalo nang lalala yan. Lalo nang magkakaroon ng effect into the older adult. Actually, kahit na po may age-related changes, kasi hindi natin maiiwasan yan, kung hindi po naman po tayo magkakasakit, kung iiwas tayo sa mga bagay na makakapag-trigger doon sa changes into our body. Kaya nga kailangan you have to teach and you have to look for the older adult para if there's some changes, agad-agad mapiprevent natin. Okay? Yung mga sakit na yon. So increase also, they are also increased susceptibility to respiratory infection. So how about the cardiovascular and hematopoietic and lymphatic? If we're talking about the cardiovascular, di ba? So alam naman natin, oxygen, okay? There are two organ that is responsible for our breathing, oxygenation. It's the heart and it's the lungs. And of course, also, circulations through the blood. So, kapag bata ka pa, as you can notice, okay, this is the picture of the young heart. Okay, so alam naman natin, di po ba, blood coming from the upper and the lower of our body comes into the, will enter into the right atrium. And it will going to pass through and goes into the right ventricle. From the right ventricle, alam naman natin, di ba? It will goes into the pulmonary artery and goes to pulmonary vein. From pulmonary vein, to the lungs, and to the lungs are exchange of gases, and then oxygenated blood will goes to pulmonary vein, and eventually it will goes into the left atrium, and then left ventricle goes to the aorta and to the systemic circulation. So, yun yung ating circulation. And look at this one. So, endothelial cells. So, okay pa yung kanyang structures and the medial layer. Medyo yung arteries, malaki pa yung daluyan. So, what happened? Due to age-related changes. Okay. So, ano man na yung mga pagbabago? Kapag bata ka pa, kain ka ng kain ng mga matatabang pagkain. So, magkakaroon po ng effect yon eventually pag matanda na tayo. Okay, this may cause atherosclerotic or merong fatty deposits into the arteries. So, kapag nangyari yon, so liliit ang daluyan ng mga ating arteries. So, kapag lumiit ang daluyan, of course, doon na magkakaroon ng factor na hirapan tayong huminga, tumataas ang mga blood pressure. So, nagkakaroon ng eventually changes into the heart structures. Kung titignan mo to, yung young structures of the heart and the old structures of the heart, medyo nagkakaroon na ng fibrosis. Okay? Hypertrophy because of that. Dahil lumiliit na, so yung daluyan, lumiliit na rin. Yung mga ventricles. So because of the senescence progenitor and myocytes, magkakaroon ng ischemic tissue. Okay? So ito ang nangyayari due to age-related changes. So aorta becomes dilated and elongated. There is a resistance to peripheral blood flow that is increases, and the effect of this, the blood pressure increases. That is why, kapag kinuhaan mo ng blood pressure yung mga matatanda, pag sinabi mo kay doctor, Doc, ang blood pressure ni Lola, 140/80 or 140/90, okay lang yan. Sasabihin sa inyo ni doktor. Kasi there are some factors, okay? Due to age-related changes, pwedeng maging maapektuhan ang daloy ng blood ng mga matatanda that may cause blood pressure. Decrease also the cardiac output and less elasticity of the vessel and more prominent arteries in head, neck, and extremities. Stroke volume decreases by 1% per year. Kaya nga po, the more na nagdi-decrease yan, what happened? Kaya nga pati yung mga pulses ng mga matatanda, medyo bumababa. Kaya nga pag kinuhaan mo, mababa po yung pulse rate ni Lola, 56 lang. Because there are some changes. Kaya lang, itong changes na to into the cardio or into the respi, kapag hindi natin nakita kaagad, ang effect po nito, it can lead into conditions, illness to our older adult. So how about the gastrointestinal? What are some changes in gastrointestinal? Okay, so look at the esophagus or, okay, esophagus. So sabi nga natin, di ba, start the gastro into the mouth. Okay, so what will be the effect? Naapektuhan ba yung mga matatanda because of tooth loss? Yes. One factor po yun. Kaya naaapektuhan yung pag-chew ng mga matatanda, hindi nila ganong na-chew yung pagkain because of loss ng teeth. May effect po yun sa katawan ng isang matanda or ng isang tao. What else? So, eventually, lalo na kung meron lifestyle pa rin, modification, pagka ikaw ay naninigarilyo, what happened? Hindi mo ganong nalalasahan yung pagkain. So, ang effect niyan, syempre pag matanda ka na, gusto mo masarap ang pagkain mo, so mataas yung kanilang salt. So, sa kanila, mataas, maalat na, sa atin, maalat na, pero sa kanila hindi pa. So, apektado rin po yung intake ng mga matatanda. Gastro pa rin yun. What else? Peristalsis movement. So, one of the effect due to age-related changes, there is slow esophagus. Okay? Esophagus peristalsis, nagiging slow na po yan. Kaya nga po, dapat ang mga binibigay nating pagkain sa mga matanda, yung mga small bites lang. Hindi natin sila pwedeng bigyan ng mga matitigas, yung mga big bites. Why? Kasi pwedeng mabilaukan yan, one factor. Pagka na-choke yung matatanda, pwedeng ikamatay nila yan. So, slow ang peristalsis movement. So, kailangan, pag pakakainin natin sila, so kailangan lalagyan natin ng sabaw. Okay? Kasi pagka dry na dry yan, medyo mahihirapan din sa paglunok. Slow ang kanilang metabolism, what will be the effect? Kaya nga nagkakaroon ng constipation. They are prone of having constipation, especially sa mga matatanda. Nose and mouth, reduction in sense of smell and taste. Kaya nga minsan wala na silang ganang kumain, ano? What are we going to do kapag nangyari yan? Siguro, no, kung pati yung plan ng kanilang mga diet, siguro kailangan isuserve mo yan. Decorative, isuserve mo yan, medyo mainit, para kapag nakita ng mga older adult natin, ganahan, ano yung paggana nila sa pagkain. Gum recession and difficulty in swallowing. So what happened to the stomach? So reduce ang elasticity of the stomach wall, that is decrease the bicarbonate production and gastromucosal protection. Delay gastric emptying. Kaya nga ang effect nito, kapag ang isang matanda walang ginawa kundi kumain ng kumain, inactive, so tapos ang metabolism medyo slow na, ang effect nito is obesity. Alam naman natin, ano, due to obesity, so it can lead into certain illness condition. So what happened to the liver? Kasi ang liver, di ba, kasama rin yan sa gastro. Shrinkage of liver occurs with loss of hepatocytes, reduce also the ability to detoxify the substance, including the drugs, and changes in bile constitution. So what happened to the small intestine? Compromised gut associated lymphoid tissue capacity. Kaya nga kailangan, di ba, pwede mo silang bigyan ng small frequent diet or meal. Pero yung hindi isang bagsakan na napakarami. Kasi hindi naman na kailangan ng mga older adult natin for growth and development. Hindi naman na sila lalaki. So what happened to the large intestine? Peristalsis is slowed down and this will decline in the rate of the cell division in lining the repair. So slow na rin po ang mga healing factor niya. Changes in microbial fauna and changes in DNA and epithelial cells. Kasi sabi natin pagka-gastro, di ba? Meron tayong content into the stomach, good and bad bacteria. Kaya lang, due to some age-related changes, yung mga good bacteria na yan, nawawala na rin. Kaya nga, prone pa rin yung ating mga matatanda for infection. So, decrease in esophageal motility. So, there will be atrophy of gastric mucosa. Niliit po yan. Pwede maging factor po ng age-related changes. Decrease also the stomach motility and less production of hydrochloric acid. Fewer cells on absorbing surface of intestine is lower peristalsis and decrease the taste sensation, esophagus more dilated, and reduce the saliva and salivary pyridine. Okay? Those are some changes in gastrointestinal. So how about for urinary? Nababago rin ba to? Yes, nababago rin po ito sa mga matatanda. So, age-related changes to the renal system, increase ang collagen deposition, and reduce the renal blood flow, and what happened to our glomerular filtration, okay? Loss of nephrons and abnormal nephron structure. So, ang nephron, that is the functional unit of our kidney. So, increase ang risk of urinary incontinence, this is due to the reduced bladder elasticity. Kaya nga pag matanda na, kailangan pati po yung intake nila, kailangan alam natin. So, ang mga matatanda, hindi ganong nakakaramdam ng uhaw. Okay? So, kahit na konti lang ang inumin yan throughout the day, minsan hindi yan nauuhaw. So, kailangan, you have to monitor the intake and the output of the older adult. So what else? Loss of the sphincter tone. Kaya nga kapag ihing-ihi na sila, so ang mangyayari dyan, hindi kagad nakaihi, so iihi na lang yan. Either sa panty, magkakalat na lang yan. So one of the factor, kaya nga po maraming mga matatanda, wala kasi tayong magagawa, due to age-related changes. Nagda-diaper. Okay, some older adults, especially in America, so paglalabas sila, so nag-ano po sila, nagda-diaper. Kasi hindi na nila mapigilan yung ihi nila. Kusa na lang lumalabas. And sabi natin, poor bladder control. Shorten urethra in some women, so siyempre di po ba yung capacity niyan? So increased risk of urinary tract infection. Kaya nga yung mga matatanda, they are prone of having UTI. Prostatic, sa mga lalaki naman, prostatic hyperplasia. This is interfere with the urine flow. So kapag ma-notice natin, pag nag-aalaga na kayo ng mga matatanda, lalo na if you are working to the nursing home, pag na-observe ninyo na si lola or si lolo, palaging pumupunta sa banyo. Bakit kaya palaging pumupunta to? Kasi alam naman natin, hindi naman oras-oras umiihi tayo. Di ba? So siguro after 4 hours, 3 hours, tsaka pa lang na-form yung ihi natin, yung capacity into our bladder para takes place para umihi tayo. Pero kapag nag-aalaga kayo ng mga matatanda na notice nyo, pabalik-balik, or else tinanong nyo may incontinence, so pwedeng they are prone to having UTI. Factor po yun. Or prostatic hyperplasia. Okay. So what happened naman? Changes in the nervous system. So anong nangyayari sa mga matatanda? So healthy brain, look at that. Okay, cerebral cortex. So itong mga cerebral cortex, hippocampus, or etong mga contained ng brain natin, the nervous system, that is responsible for our memory. Okay, yung mga functions natin, nandyan po yan. So what happened to our healthy brain? Lalo na yung cerebral cortex. So ang old brain, kung makikita mo, okay, nag-iba na yung structures. Kaya nga, di ba? So pag tumatanda ka, ang dami mong nakakalimutan. Okay? Ang daming effects sa'yo. Bumabagal ka, your functional ability, slow ang paglalakad, even, okay, yung pagsasalita mo or some organ. So sa brain pa lang tayo nag-uusap. Pero yung ibang organ, nag-change din. Kaya nga, kapag hindi natin makikita yung mga possibility na pwedeng magkaroon ng disgrasya or yung safety ng mga matatanda, importante pa rin na tignan natin kung what's really happening. Actually, ang brain, pati yung kanilang mga emotional, okay? Yung emotionally, apektado rin po yan. So, decrease ang brain weight, there will be reduced the blood flow in the brain. Kaya nga po pag tinanong mo si Lola nag-iisip pa siya. Pag tinanong mo, hindi yan right away or quick na sasagot sa'yo. Mag-iisip muna yan, parang naglo-loading pa. Lalo na kapag matagal na kayong hindi nakikita ni Lola, pag tinanong mo, dumalaw ka kay Lola. Lola, kilala mo pa ba ako? Mag-iisip muna yan. Okay? Tititigan ka muna yan. Kasi medyo loading pa. Kasi this is due to age-related changes. Changes also in sleep pattern. So yung cycle ng kanilang sleep pattern, awaken yung kanilang melatonin. So it also affect. Kaya nga po yung cycle ng mga matatanda, di ba? Kagaya ng lecture ko sa inyo last time. So mabilis silang makatulog pag nakasandal, tulog kagad, pero mabilis din silang magising. Decreased conduction velocity and slower response and reaction time. So, how about the age-related changes, especially into the senses? So, hearing. So, tympanic membrane, sclerosis and atrophy. Medyo lumiliit na rin po yan. So, alam nyo ba na ang mga matatanda, kapag sa loud sounds, hindi niya kayo naririnig. Minsan tinatawag nyo, ang lakas-lakas, Lola, Lola, Lolo. Dead ma, hindi kayo naririnig. Pero pagka sinabi nyo, bingi talaga to si Lolo, medyo nag-low down yung voice niyo, naririnig nila. Kaya nga po, bigla silang magagalit sa inyo. Kasi sasabihin nila, hindi pa ako bingi. Pero kaya nga, if you're going to talk with your older adult, kailangan po face-to-face nakaharap kayo. Kasi kung hindi man kayo naririnig gaano ni Lola or ni Lolo, they will be able to read your lips kung ano po yung sinasabi niyo. What else? Increase din ang serotonin productions and concentration of keratinocyte. Kaya nga yung mga lolo't lola, hindi nilang sinusundot yung tenga nila. Hindi nila alam masama yun. So due to age-related changes, lalo nang nagkakaroon ng problema yung tenga nila. More opaque lens and decreased pupil size sa mga mata naman nila. Kaya nga nag-iiba rin ang color. More spherical cornea. Kaya nga po yung mga matatanda, once na tinapatan nyo ng ilaw, so medyo yung kanilang kamay, sinaside pa nila kasi hindi nila makita because of some changes. And more spherical cornea. How about the smell? There is also impaired ability to identify the odors. Kaya nga kapag nagluluto si Lola at si Lolo, or si Lola pag nagluluto, so you have to make sure na palaging yung gas range nakasara. Kasi hindi na nila naaamoy yan. So medyo nababago na po yung kanilang mga pang-amoy. So how about the taste? High prevalence of taste impairment. Okay? Although most likely due to the factors and other factor kung bakit nawawala yung taste. So sabi ko nga sa inyo kanina, example, kapag yan naninigarilyo or taking medication, minsan nagkakaroon tayo ng problema. Nawawala yung panlasa nila. Okay? How about the touch? There is also reduction in tactile sensation. Okay? So sabi natin, di ba, yung mga hair sa mga balat, medyo nawawalan ng sensation. Kaya nga sabi ko sa inyo, di ba, safety pa rin. Kasi po pwedeng ma-burn yung mga matatanda without hindi nila nakikita na yung factor na yon. Minsan sasabihin nila, ewan ko saan ako nagkasugat. So nawawala yung mga sensation minsan na nagkasugat sila or napaso sila. So endocrine, alam naman natin, di ba, endocrine system that is responsible for the productions of the hormone. So what happened? Decrease ang thyroid activity, ACTH secretion decreases also, pituitary gland decreases in volume, gonadal secretions declines with age, and there is insufficient release of insulin by beta cells of the pancreas. Kaya nga minsan, kain ng kain, due to age-related changes, decrease na si beta cells. So, ang effect nun, they are prone of having diabetes. Lalo na kung inactive yung mga older adult natin. Okay, how about the reproductive? So, female and male internal organs and external genitalia. Ano na ang nangyayari due to age-related changes? Okay, the male capacity of seminal vesicles reduces and possible reductions in sperm count. Pero not necessary na wala ng production. Reduction lang po. Kaya nga po yung mga matatandang lalaki, no, kapag nakapag-asawa ng batang babae, may possibility na mabuntis pa nila yon. Kasi due to age-related changes, hindi natin sinasabi na nawawala na ang production. Okay? So, naliles, nagkakaroon ng reduction lang. So, what happened to the venous and arteries? Magkakaroon ng sclerosis of the penis and prostate enlarges in most men. Yun ang usual na nagiging sakit ng mga matatandang lalaki. How about for female? Siyempre, factor yan, reproductive. Siyempre, menopause. Diba? Wala ng production ng menstruation. So, fallopian tubes, there is atrophy and shorten. The ovary is thicker, becomes thicker and smaller. And the cervix is smaller, dry, less elastic vaginal canal. Okay, and flattening of the labia. Ma'am, question. Yung mga matatanda ba, pwede pa rin mag-sex? Yes. Yung dalawang mag-asawa, pwede pa rin naman. Kaya nga sabi nila, di ba, kailangan ng lubricant. Especially kanina nilalagay yan sa babae. Kasi masakit po yan kapag hindi walang lubricant yan. Kaya nga nauuso sa ibang bansa yan. Kasi sabi nga nila, kahit matanda na. So, kailangan pa rin yan, needed by our body. According to the research, nakakapagpahaba daw ng buhay. Okay? So, endocervical epithelium atrophies. Kaya nga, pagka menopausal ka na, and then nawala ka na ng menstruation, pwedeng ma-develop. Okay? Pero siguro, yung iba, hindi naman. Not everybody. Uterus is smaller in size and endometrium atrophies, kumiliit na rin po yan. And the alkaline vaginal environment and loss of vulvar fat and hair. Kaya nga mauobserbahan nyo, pagka mga matatanda, okay, sabihin nyo, nawawala na rin yung mga hair, yung mga pubic hair, nagiging less na rin. So parang bumabalik sa pagkabata yung mga vagina nila. So, how about changes to the mind? Okay, nababago ba to due to age-related changes? Yes, yung kanilang personality, even memory, intelligence, attention span, and the learning. Okay, personality, there's a drastic changes in basic personality normally. Do not occur as one age. But the kind and gentle old person was most likely that way when young. And likewise, the cantankerous old person probably was not mild and meek in earlier years. Actually, yung mga personality nila, no? So, kapag kabata pa yan, in some other older adult, parang hindi naman. Pero gradually, yung mga personality nila, napabago na rin due to the factor. Okay, na hindi na sila nakikipag-mingle into the other people they do not want to go and talk with. So, sa personality nila, merong nababago pa rin po. Memory. Okay, lalo na sa memory. The three type of memory are short term. So, lasting from 30 seconds to 30 minutes. Kaya nga marami ng mga bagay na kung saan nila tinago, biglang nakakalimutan nila. So, ang effect pa nito, pinagbibintangan tayo kung saan nila nailagay. So, you have to explain and understand. So, long-term naman, involving that learned long ago and the sensory, which is obtained through the sensory organs and lasts only a few seconds. Kaya nga, minsan, some older adult, they are prone of having dementia. So, minsan kilala kayo, minsan nawawala. So, talagang minsan nag-memory loss sila. So, kailangan lang talaga you have to look for your safety ng mga older adult. And paano ma-enhance itong mga memory na to due to age-related changes? Siguro sa sobrang daming inaral, yung mga intelligent box, yung memory box ng mga older adult na puno na ng naputo. Kaya nga short memory na lang, meron sila. Siguro ma-enhance natin to through activity. What kind of activity para ma-enhance pa rin yung memory ng mga matatanda? Just for example, yung mga crossword puzzle, okay? Alam nyo ba kung bakit yan hanggang ngayon meron pa rin? Kasi sa mga older adult, that's good. Yung kanilang mga word puzzle na yan. What else? Okay, kung makikita nyo sa cellphone, marami pong to enhance the memory, yung mga games na pwedeng laruin ng mga matatanda para yung memory nila hindi ganong mag-decline, still nandun pa rin. Magbasa ng mga newspaper, that also helps for the older adult. Actually, mas maganda nga kung pababasahin nyo sila ng malakas. Okay? Para pa rin na-enhance yung kanilang ability. Okay? So next, intelligence. In general, it is wise to interpret the findings related to intelligence and the older population with much caution because the result may be biased from the measurement tool or method of evaluation used. Kasi sabi nila, some other people sabi intelligence daw, nandyan lang yan. Hindi yan nawawala. Okay? Kaya lang, di ba, some other, okay, yung mga research, sabi nila, yung mga IQ, okay, yung mga IQ ng isang tao, kung ikaw bata ka pa, sobrang talino mo. Okay? And then, hindi mo in-enhance yung pagkamatalino, so bumababa yung IQ test niya. Okay? So, there are some measurement tool or method to evaluate the intelligence of the people. Kaya lang, talagang ang taong araw, sabi nila, according to some research, pag matalino daw talaga. Okay? Learning. Although learning ability is not seriously altered with age, kahit matanda na yan, pwede pa yan matuto. Walang bobong tao. But other factors can interfere with the older person's ability to learn. So including na motivation, attention span, delayed transmission of information to the brain. So yan yung mga some changes no? And perceptual deficits and illness. Plus, syempre yung ating mga senses, lalo na pag tumatanda, humihina yung mga vision, humihina yung pandinig. Kaya nga, it also affect the learning ability of the older adult. Kaya lang, so by teaching them, siguro, pwede naman nilang matutunan pa yung mga bagay-bagay, yung mga simple tasks na pwede nating ituro sa kanila. Attention span, the older adults demonstrate a decrease in vigilance performance. Okay, the ability to retain attention longer than 45 minutes. Parang mga bata yan eh. No? Diba? Ano kaya yung attention span ninyo? Pag medyo tumatagal na, nawawala na, di ba? So, kailangan yung attention span is just the same pag matanda. So, attention longer than 45 minutes. Pero more than that, medyo wala ng attention siya. They are more easily distracted by irrelevant information and stimuli. Kaya nga pag nagtuturo kayo, when you teach to the older adult, kailangan simple. So simple na maintindihan nila kagad. Kasi pag marami pa kayong sinasabi, mas complicated, mas hindi nila maiintindihan. And of course, environmental factor. If you're going to teach the older adult, kailangan kung ano yung topic nyo, yun lang. Hindi yung kung ano-ano, yung inilalagay nyo sa topic na yun. Mas lalong naguguluhan sila. Okay. So, what else? So, sabi nga natin, di ba? Ano yung common? So, pag sinabi natin kyphosis, di ba? Parang hunchback. Medyo na huhukot na. Okay? So, normally, sabi natin almost 1/2 inch every 10 years after the age of 40. Okay? Yung height loss ng mga matatanda. Imagine niyo lumiliit sila. Okay? So, what else? Okay? Sa mga old female, so, nagkakaroon ng gray hair and skin pigmentation. What will be the effect nito? Ma'am, bakit po gano'n? Nagkakaroon ng gray hair at skin pigmentation. That is because of the decreased number of the functional melanocytes that is responsible, okay, for the growth and the color of the hair and the skin of the older adult. Okay? So, anong factor? Bakit nagkakaroon tayo? Okay? So, bakit lumiliit o whatever? So, this is due to degenerative. Okay? Dahil sa pagtanda, degenerative factor. Okay? Not necessarily na because of arthritis or anything. So, kung bakit yung mga buto ng mga matatanda, bakit kaya yung paglakad ng mga matatanda medyo slow na, and then minsan pwede silang mag-slide just because yung synovial fluid, okay, less na. Sabi natin wala ng productions ng mga hormone. Kaya ang nangyayari, pag less na yung synovial fluid sa tuhod, okay, so kung pwede, that is the factor. Kaya ang mga matatanda, pwede pong madulas. Okay? Kasi hindi na stable yung mga buto nila, yung mga gait nila. Another factor po yun. Okay? So, may questions pa po ba kayo? Our quiz is 10 items lang po. Okay? So,